Good morning. Let's see here. Okay, good morning. Testing, testing, testing. Good morning. Testing, testing, testing. Everything is working fine. So I'm back. I'm back after a while. And as you know, we have been, let's see again. Okay. I've been off few weeks, and today we already started. Today, this session is a part of called Ayurvedic Yoga Therapy, and is a part of your yoga teachers training course of Zenya Yoga Academy of Newport News, Virginia. And it's a long session. We do it for the whole weekend. We do from today will be 9 a.m. to 6 p.m. and tomorrow will be also 9 a.m. to 6 p.m. We already started the session at 9 in the morning. We've gone through a little bit of introduction, and all the students have joined this Facebook Live class. And let me start with a little introduction before we show the practice. This is a practice session for Ayurvedic Yoga Therapy. Many of you have heard the word Ayurveda, and the root of Ayurveda in the yoga is from the same source. It comes from a tradition called Vedic tradition, which originated in called Indus Valley Civilization, which is now in the country called Pakistan, and the main cities are called Mohenjo-daro and Harappa. Ayu means longevity, Veda means knowledge. Ayurveda basically means a knowledge to not to have any disease. Disease is a failure of Ayurveda. Ayurveda is a preventive medicine. It is called the Shastha-rokha, maintenance of your health. It also has a component called Rogir Chikitsa or Rogir Chikitsa, treatment of the disease, but it's primarily a preventive health maintenance. Ayurveda is a balance of our psychophysical body type along with our environment. We call it a microcosm and the macrocosm. The environment influences our genetics. We all have genetics mutation, genetic changes. You name it, I have it. I have a genetic mutation for breast cancer, colon cancer, lung cancer, diabetes, hypertension, everything. But the gene these days, we know, does not cause any disease or does cause any changes. The gene has to express. And the gene gets expressed with the effect of the environment around you, which is called epigenetics. So people are interested, you can go ahead and take a look at epigenetics and you learn Ayurveda and yoga therapy is nothing but epigenetics. Ayurveda is based on called energy medicine also. This is also called a living medicine, functional medicine, also all different names you hear. Precision medicine, personalized medicine, we call it a pharmacogenomics. So what it is, according to Ayurveda, the universe is made of 5 elements. It is not a Big Bang theory. Initially, the whole universe, there was a space. In the space came a fire. Fire caused in the space came a air. Air had a friction caused fire. Fire melted the cloud from the water. Water froze into earth. Space, air, fire, water, earth. And all the 5 components we also have in our body. But based on the attributes, they call it the gunas, we have a different functional movement of our body, which is called psychophysical body type. And each psychophysical body type generates a different kind of disease. So when you look at a person, a very obvious person is always mobile. I mean, they cannot sit down in one place. They'll be moving around. They're sitting. They're always talking. They can never shut them off. Both in mentally and physically, they're very mobile. They are elements which are in different proportion. Primary elements is a space and air. Air is dry, air is mobile. These people are very dry, they're mobile. These people's skin, if you put oil in the skin, it gets absorbed right away. They're very creative. They're very anxious mentally. They call it a vata, V-A-T-A, vata. They get a different kind of diseases. Vata people develops more neuropsychiatric and musculoskeletal disorders. All the back pain, knee pain, hip pain, depression, your multiple sclerosis or Parkinson's disease, degenerative joint disease, neurological disorders, all due to vata-related disorder. These people has a primarily high energy of vata, which is a catabolic energy. And they need to be balanced. And the balance of this energy is primarily a daily practice of yoga and a daily routine called dinocharya. When to get up, when to eat, when to sleep. I've gone through many of my classes and they have in the YouTube. You can go and take a look at it in dinocharya. Vata resides in the colon, this mobile energy. So all the asanas which are grounding below the belly button, like lotus pose, a vajrasana, padmasana, vajrasana, thunderbolt, or say your seated forward bend, Paschim Uttanasana, or laying down your knee chest, Pavan Muktasana. So I'll show it to you and go over with you. Next psychophysical body type is Pitta. Pitta, the primary attribute is the attribute of fire. Attribute of fire means they are very hot, they're very controlling, very demanding. They have an attitude of they are the king. They're very angry, but very perfectionist. I mean, if you go to a Pitta house, you'll see all the shoes are lined in orders. When you go to their closet, every shirt, every clothings are properly, color coded, match. I mean, it's wonderful to go and see them. Everything is in order for them. They get a different kind of diseases. They get a disease for the inflammation. They get a disease of the inflammation, and they get a disease of the solid organs, like your liver, your heart disease. It's also all these inflammatory diseases they have. What is going on? That's okay. Let me stop this. Focus. Do not disturb until evening. Okay. Sorry, I have to stop this, all the calls I'm getting. Okay, so Pitta. So you'll see the Pitta disorders, and Pitta resides in a small intestine. Especially they're also in the navel area. All the asanas related to navel area will be your Pitta. So if you look at, say, boat pose, Noka asana, or you get a bridge pose, Setuvan Sarvanga asana, or you can say, if you can say, you can do a camel pose. The camel pose will be both Pitta and Vata balancing, because of grounding and also centering in your belly button. So all the asanas which center towards belly button will be your Pitta balancing asanas. Kapha, the other psychophysical body type, they're all grounding. They never move, never come around. So they love to be in grounding. So people like a Vata, they all like to be up and around, moving. They will do all the, standing poses. They will do a, sun salutation. But they need to be, for the balance, it's called law of opposite. They need to be grounded. Kapha, on the other hand, they need to be mobile, go up. They're primarily attributes of the water and the earth. And they're very cooling, grounding. So they need some energizing asanas, stimulating, heating. So they'll do like a Gomukhasana, cow face, or spinal twist, like a Ardha Matsyendrayana, or very heavy, like I say, downward facing dog, or maybe the yogic push-ups and sit-ups. There also needs a different kind of pranayama. In Vata, they have inhalation proper, exhalation is longer, but they're interrupted because of their mobility. So they will learn how to do a longer, smooth exhalation, and primary pranayama, which balances Vata, is your alternate nostril breathing, Anulom Vilom pranayama. You have a lot of other pranayamas who'll do, we'll call it, Brahmari pranayam, Ujjayi pranayam. Those are all, they have to bring into a focus. Pitta, on the other hand, in the pranayama, they have a proper inhalation, but very short exhalation. In yoga, the primarily we practice is a longer exhalation. We do a effortless, slow breathing in, and we breathe out longer than breathing in. So it teaches cooling, long exhalation in Pitta, primarily called Sitali Pranayam, Sitkari Pranayam, we call it Sadanta Pranayama, also called a moon salutation. Vata will do a sun salutation, but very slow, rhythmic way, because they're very fast, they're very mobile. Kapha, on the other hand, they're very, grounded. They get a lot of secretion, the drainage, so they need a very, highly charging pranayama, like a bastrika, bellows, or a rapid, your Kapalbhati pranayama, or breathing of fire. Agnisar Kriya. I'll show it to you, all this stuff, during your practice, so you will see it. Same in meditation. Vata in meditation, they need a guidance. So they will do better with what they call a focus meditation. They will do the meditation closing their eyes, focusing on their breath, called a breath-centered meditation, or focusing on a mantra. Mantra is a vibration. Mantra is a vibration like it has the same vibration as your brain. It comes down, quiets down your brain. Pitta, on the other hand, do not listen to anybody, but Pitta listen to one person, which is self, themselves. So Pitta will do meditation. Pitta will do meditation based on focusing on self. And Pitta doesn't need any perfection because they're already very perfect. If you let them do a tree pose, Pitta will do a better tree pose than you. Kapha, on the other hand, does not want any grounding meditation. In fact, when you do a savasana, corpse pose, or yoga nidra, a Vata can never do it. Vata will have eyes, they will be opening and closing their eyes, they will be moving around this like, and Kapha people will go gone, or they will look like they're almost falling asleep. So Vata will need a moving meditation. Moving meditation is called walking. When they're walking, they pay attention what they're walking. Or it's called a Kati Chakra Asana. So they will do a hand movement, moving your west, rotating west, Kati Chakra Asana. I'll show it to you. Or they call it the Jyoti Tratak. Tratak is the movement of the eye. Jyoti is looking at a flame. Jyoti Tratak. That's also the Kapha meditation. Even for the gaze, when they will do the practicing, Vata is always looking all over when they're doing it. They're not looking higher. So Vata, you will teach them how to practice with a gaze down. Vata, also very mobile. They will go beyond your asana limitation. If you let them do the, say, hand and feet, Padahastasana, or head touching your knee, you'll see their head will go past the knee. We call it looking at your rear end, looking at your hand. But you control them. You don't let them do it that much. Pitta, on the other hand, their gaze will be all towards self, looking at their own self. Very, very important. Otherwise, Pitta will never get into the balance. And Kapha, the head is always done. Kapha needs to be gauged high up. Kapha needs to look high up. Kapha needs to do more faster. Like say if there is sun salutation, there will be a faster sun salutation. Vata will do a very slow, rhythmic sun salutation. Kapha will be doing. So most of the people who has a kapha will have a diseases of their fluid-related disorders, like congestive heart failure, kidney-related disorders, fluid-related disorders, or their small tumor. It's all you will see. This is a gross explanation, but when you look at person, we do the persons with their Vata, Pitta, Kapha, they have all three components in balance with diagnosis. The pulse diagnosis primarily, we do a tongue diagnosis. We have a lot of other called Ashtabidya Parikha, like eight ways to diagnose these are called doshas, dosha imbalance. Vata, Pitta, Kapha is called a dosha. And sometimes when you don't know anything, we do call a tridoshi. That means which is applicable for all the three doshas. Most of the people have a very high energy of Vata. And next will be your Pitta, and the lowest will be your Kapha. So if you have any concern, when you see a person, when the person comes to you with a diagnosis of a disease, which yoga therapists or Ayurvedic yoga therapists are not doing, we are not doing a diagnostic, but some physician sends it to you, and they could hip pain, knee pain, back pain, which is a Vata disorders, you balance the Vata. When you balance the Vata, Pitta also get balanced because actually Vata pushing Pitta. Vata pushes the Pitta energy. So if you have any concern about the person's functional body type, you can always start with a Vata balancing practice. So let's start with the water balancing practice. You can sit down in a chair, you can do it. Or if you can sit down in a ground, you can do sitting in a ground. So I have both. I have a chair, and also the first component is called Merudanda Achal. Merudanda Achal means you have to keep your spine straight. If you sit down in chair, you'll keep your spine straight. If you sit down in ground, you'll keep your spine straight. And I'm always sitting in a stool, keeping my spine straight. I'm sure I have shown it to you many times, but I'm showing it to you for the students now. These are called your kneeling stool. This is a kneeling stool. You put down here as a kneeling stool, and when you sit down with your knees in the front, body will be always, your spine will be straight. That's the way I look at my computer. This will be my keyboard. This will be my screen. And I have one which is called a motorized table. The table goes up and down and always sitting in a spine straight. Once you keep your spine straight, a relaxation response sets in. The whole asana practice is a relaxation response and the activation of parasympathetic tone. Parasympathetic tone controls our digestion. Parasympathetic called calm and digest, and we'll talk about more digestion, especially I'll talk with the students after probably the lunch about Ayurvedic digestion. So let me go back on the yoga mat, okay? If you're sitting in a chair, you'll be able to do everything in your chair. Again, see, if you're sitting in a chair, this is exactly what you will be doing. You'll be sitting in a chair, you'll be keeping your spine straight, you'll be grounding your feet, and if you can go all the way to the back, same thing. Keep your spine straight. This is a chair for my yoga practice. I have a little bit of a handle, but let's see how you get into the grounding postures or grounding asanas. You don't have to do it, what I'm doing, but look at it, we do a daily routine. Daily routine is called your dinocharya. A daily routine helps you. So when you get up in the morning, get up from the bed, we sit down. This is called your squatting pose or malasana. And then we'll drink 2 glasses of water, primarily in a room temperature. See, we don't like to do imbalance. We don't like too hot a water or too cold a water. We water which is appropriate for our body temperature. So room air, lukewarm is fine. Your hand gets relaxed when you can separate to your fingers. This is a relaxed hand. Tight hand will be like this. Hand get relaxed with a mudra called a adhi mudra, or it's also called a balo mushti mudra. That's the way baby closes their hand. Thumb inside and close. Wrist gets relaxed with extension. We do the breathing in, breathe out. Hand also, you can do breathe in, breathe out. It's like a yogic fist or a baby fist. Once you relax, you can see your hands will be all over, your hands will be all separated. So you can put your one elbow inside, other elbow inside. Extend your wrist, separate your fingers, keep your spine straight, close your eyes, breathe out first. Take a slow, long breath in. Breathe out longer than breathing in. If you keep on doing it, you'll see your breathing will get slowly and slowly longer, and it will be a lot more smooth, and your exhalation will be longer than inhalation. Inhalation is sympathetic, exhalation is parasympathetic. When you are able to sit down like this, if you cannot do it, just go in sequence. Like initially, you may be able to do here. Stay here. Close your eyes. Do your breathing. Breathing out longer than breathing in. 5 times, 10 times, 20 times, 20 days, 30 days. Based on the person, you develop a phenomena called neuroplasticity, or habit forming. You'll be able to come down to a little bit more. Slowly and slowly will come to that desk. Now, how do you get into this posture? Suppose you're starting initially a Ayurvedic yoga therapy. You want to do a Vata balancing poses. Lotus pose or Padmasana is a powerful Vata balancing poses. Now let me guide you through how you do it slowly. I've shown it many times in the class, but it's a daily practice we do it. First, you will be able to sit down with a cross-legged. It is called an easy pose or a Sukhasana. Then you have to listen to your body's signal. What are the body's signal? The first signal is pain. If you get any pain in this, you back off. You back off to a position where you will be able to feel a little discomfort. We call it a comfortable discomfort. Next, if you are not comfortable here, you can always put yourself to the back and keep your spine straight against the wall. Support your spine against the wall, and you will develop this phenomena of neuroplasticity slowly, and eventually this thing is going to happen. If you try to adjust, like if you push it down, it'll come back higher. So don't adjust. There is no need for adjustment. It will come to you. You don't practice yoga asana. Yoga asana comes to you. Yoga is a philosophy. 196 sutras called as small aphorisms, of which 193 is quiet down your mind. It's a practice called an 8-limb practice. As a yoga teacher, you have to memorize this thing. Yam, niyam, asana, pranayam, pratyahar, dharan, and samadhi. Yam is a social restraint, 5 social restraint. Niyama is a personal restraint, 5 personal restraint. Asana is your alignment, both external and internal alignment. Pranayama, pranayama. Prana is a life force. It's a subtle energy, keeps us awake, alert, and alive. controlling and restraining prana. It is a voluntary regulated breathing. Pratyahara, controlling your senses. Pratyahara means reject. Ahara means what you intake. It's not what you intake through our food, Our intake is I see, I hear, I smell, I taste, and I touch. Very, very important concept. Dharana is the focus, Dhyan is the meditation, Samadhi is the union of our body, mind, and spirit. So meditation is the seventh limb of yoga. There is nothing called yoga and meditation. You enter into a state of meditation when your body is relaxed, and the body is relaxed with asana called Sthiram Sukham Asana. I'm telling all this thing for you to able to sit down in a posture for a longer period of time. Sthiram, stillness. Sukham, happiness. Asana is a grounding pose. Now, most important concept of yoga as a therapy is health is a balance of your body, mind, and spirit. Most important balance is the balancing both sides of our brain. We are too lateralized. I'm either right-handed or left-handed. We do everything with the right hand. We never use our left hand. You need to use your left hand. Every single day, if a right-handed person, you brush your teeth, you do everything, with your left hand. So here, also I'm sitting down here, once I'm comfortable, I'll go ahead and change my foot to the same easy pose, but putting the feet opposite. Now you will see it will be more comfortable in one side than the other side. So practice more which side you feel it is more comfortable. We come to in front of you a little bit more so you'll be able to see better. Okay. Now, hand mudras. Hand mudras are very important. Hand mudras are very important means mudra is a hand gesture. Hand is a connector between your body and mind. You touch your index finger and thumb. This is called a Gano mudra or a Dhanu mudra. There's a lot of mudras we use during your practice. Put your index finger down. It's called a Vayu mudra. It balances your Vata. This one balances your Pitta. Touch your middle finger and thumb. It's called a Shuna mudra. It improves your hearing. Ring finger, little finger is called your Prithvi mudra. It balances your kapha dosha. Very important for your truncal obesity, diabetes. Little finger and thumb is called a Varun mudra. It controls your water content in your body. Very good for your skin, very good for your kidneys, for the bladder. Women with a bladder dysfunction. Ring finger, little finger and thumb. This is called your Shakti mudra. So mudras are also used in Ayurvedic yoga therapy because Ayurvedic yoga therapy is directing your prana to the organ of healing. Touch your middle finger, ring finger and thumb. This is it's called Apna mudra or your Pachan mudra, digestion mudra. Extremely important for Ayurvedic yoga therapy. High level, undigested food is called a toxin, it's called ama. We call it a mother of all the diseases. It's called MOD, mother of all the diseases is the ama. Ama blocks our channels called the nadis. We'll talk to the students. We call the channel called nadi shuddhi. When the ama blocks the channel, we get a disease. Prana has to flow through the channels. The ama has to be digested. called Amapachana. Nadi Shodhana, cleansing all the channel. Agni Deepana, there is a fire within our stomach. We need to ignite that fire, the Kapalbhati Pranayama, Agni Kriya. And finally, it's called Ojosthapana. We establish more ojas. Put index finger down, Kalapna Vayu Mudra, Hriday Mudra, very good for heart, and a lot of mudras. These are called Linga Mudra, Ganesh Mudra, this is called Hakini Mudra, this is your Shankha Mudra, alternate fingers you do. This is called your Dhenu Mudra. It balances both sides of your brain. But I'll go over, or you can go to my YouTube, you'll see all the mudras. So now you're here. If you touch your index finger and thumb and put it over both the knees. Next is quiet down your mind. According to Ayurveda, mind is the content of your five senses. I hear, I see, I smell, I touch. Close your eyes. Eye is just an outside extension of your brain. Vision is the mind. The moment you close your vision, close your eyes, the mind quiets down. People with vata cannot keep their eyes closed, but I teach them how to do it. Then you bring the component of your breath. Lung is like a balloon. It has 6-liter capacity. Needs 1.5 liter to keep the lung open. Got a 4.5 liter to exchange the air. Normally, we exchange only 0.5 liter, 500 cc. All the muscles of respiration are called skeletal muscles, which can be trained. So slowly and slowly you will see, you will have a completely effortless breathing. Effortless breathing means as if you are breathing a normal breathing. In effortless breathing, you'll be able to talk. You'll be able to sing like what I'm doing. So example is breathe out first. So the count of 2 in, 1 and 2 in. Count of 4 out. 1 and a 2 and a 3 and a 4. Very simple. Plus, we have been doing it for a long time. We can do it way high up as we can even do 10 seconds in, 20 seconds out completely effortlessly. The moment you practice your breathing, you reduce your number of breath. Normally, breathing is around 15 to 16 per minute. The moment you can do 2 seconds in, 4 seconds out, 6-second cycle, you already reduce the respiratory rate to 10. For us, I can show it to you, we can easily do 4 seconds in, 8 seconds out. Breathe out first. Very easy. I did 4 seconds in, 8 seconds out. So 12, now my respiratory rate is around 5. If I keep on doing it, I develop the neuroplasticity, and I'll be breathing like that when I'm also sleeping. I'm breathing like that throughout the whole day. In animal world, you have seen the animal who breathes faster, they live little less. The animals who breathe very slow, they live longer. Turtle breathes about 5 times a minute, 4 to 5 times. They live 100, 200, 300 years. Dog breathing about 30, 40 times a minute, lives only 15, 20 years. So we know from the animal world how long they live. So let me show it to you very easily, just so you will understand what I'm talking about. I'll be able to do a 8-second in, 16-second out. First, breathe out first. It was 5-second, it was 8-second in, 16-second out. What happened here? Okay, somehow some call came in. Okay, so what I just did, 8-second in, 16-second out, because we practice it every day. So now put in the grounding posture. From here, you can do a next asana. Take your heel all the way to the back. Put your one foot on the top. Your knees will drop down. This is called your Siddhasana, or a perfect pose. You go through the same cycle again with your Dhyana Mudra, touching your index finger and thumb, closing your eyes, paying attention to your breath. Breathing out is parasympathetic, breathing in is sympathetic. Longer exhalation, calm and digest, you will come into this posture, and this posture will come to you. Opposite side, take the heel. Now, right foot heel go to the back, left foot is high up, both the knees goes down. Next grounding pose, you take your foot, put it in the top, half lotus, or your called swastika asana. Here, if you feel pain, you back off. Even if back off. I mean, you need to be in a state of little discomfort, but not pain. And then able to breathe completely effortlessly. Another relaxing technique. Remember, these asanas are not that you are trying. I'm not flexible. Flexibility will come to you. You will never be flexible on your own. Separation of the toes are also, you can put your fingers, see, if fingers in between your toes. That same way, my finger goes to the toes get separated. When the toes get separated, the feet get relaxed. Remember, ankle joint and feet relaxation is extremely important in yoga practice. Your weight gets transmitted through your knee joint and hip joint, but all of your body weight is being transmitted into your ankle joint. We also practice daily called Jalneti. We cleanse our nose every single day. It's a neti pot. In a neti pot, we put some water and a little bit of non-iodized salt. We put it through one nostril, it comes out the nostril, we blow it out, remove all the mucus and all the gunk you have inside, and your nasal passage, breathing becomes very smooth and effortless. You do get some fluid retained in the sinuses, so when you do Kapalbhati Pranayama, sometimes some water might come out. Progressing your grounding asanas. Remember what the grounding asanas for Vata is. The asanas are below your belly button. Below your belly button, grounding poses are balancing your Vata dosha, balancing your catabolic energy, balancing your mobile attributes of your psychophysical body type. From this posture, you are so comfortable and you're so relaxed, you can take the other foot in the top and able to sit down, what is called your lotus pose. We have been practicing a long time. We can get into the lotus pose very easily. But I showed it in sequence. And then in this posture, when I keep my eyes closed and I pay attention to my breath gets lot smooth, lot longer, and slowly it becomes deeper. So more carbon dioxide is removed, more oxygen comes in. You also incorporate your breath called pranayama along with your asana practice. Like in this posture, we'll be practicing a pranayama, say your Kapalbhati Pranayama, breath of fire, Anulom Vilom, alternate nostril breathing pranayama, or your breath holding and inhalation, breath holding and exhalation, these are kriya. These are all you do along with the asana. So asana and the pranayama together. Slowly and slowly, you enter into a state of meditation. And meditation is the medication. Now, just want to show it to you, especially for the students, you can see it, that when I'm comfortable sitting in this lotus posture, and remember, it is not my age, it is my mind. The body is a hardware, mind is a software. Mind will be able to control your body. All the people talks about, oh, I could used to do it, but now I cannot do it because I'm getting into this age group. Yes, we are getting into the age group, but if you do daily practice, everything will come back to you. You feel lighter, you have a sense of lightness. So you put your hand on both sides, take a look how beautiful it is. Push your hand down, your whole body is going to go high up. This is called Tolasana. You are raising your whole body high up and you'll be able to stay here. So I'm looking at you, I'm talking to you, I'm absolutely effortless. So that is the state, you have to bring it to yourself. It is not that I'm practicing 1 hour a day, 2 hours a day. I'm practicing 24/7. Practicing my breathing, I'm doing my sitting down, getting high up, I'm doing into the grounding pose. It's a wonderful asana to balance your vata. Next one is Yog Mudra or Bhu Namaskarasana. Bhu Namaskarasana is Bhu is the ground and a Namaskar. You can do even this posture. Put your hand on one side, slowly bring your head down. See how far you can come down. When you come down, the most important yoga therapy is stay in the pose. Stay in the pose between 5 to 10 breaths. Breathing out longer than breathing in. Bhu Namaskar. It's the ground, Namaskar is salutation. And it was the Yog Mudra. In a Yog Mudra, what you do, you try to keep your spine straight. The way you keep your spine straight, you look straight. That's to keep your spine straight. Then slowly drop your head down. So if you can put your hand in the back, hold your left wrist, put your head all the way down, see how far you can come down, and listen to your body's signal. If you feel a pain here, you back off. Find the place where you don't have any pain but you will discomfort. Stay here between 5 to 10 breaths. And you'll be able to talk. That means you are able to do your five to 10 breaths, breathing out longer than breathing in. Asana is called Yog Mudra. Wonderful. You feel so relaxed. Your breathing, when your breathing becomes so effortless, so the breathing becomes very deep and you exchange more. Remember, person who is dying, what a sequence of dying, we say will expire. Last breath comes out. When lung stops, then the heart stops. Heart stops, then the brain stops. Brain stops, and all the cellular function stops. Improve your lung function, improve your heart function, improve your brain function, improve your cellular function. So at the cellular level, say the diabetes, the beta cells of your pancreas are not functioning properly to secrete insulin. Able to improve your breathing, you'll be improving your beta cell function. Kapalbhati Pranayama is almost a therapy for your diabetes. Paschim Uttan Asana, seated forward bend. So if you put your feet in the front, Hands on side, keep your spine straight. It's called Dandasana. Separate your toes. Breathe in, breathe out. You can do your ankle. Breathe in, breathe out. Breathe in, breathe out. You can rotate your ankle. Keep your knees straight. Don't bend your knee. Try to see wherever your hand comes. Wherever your hand comes is okay. Don't push yourself. If it comes, you can hold your toes, it's great. We've been doing for a while, so you can do it. So you can even bring your whole body close to you, holding your toes. In fact, you can put your whole hand, clasp your hand. And then keeping your knees straight, slowly drop your head down. Be sure keep your spine straight. Don't bend your spine. And then able to stay here 5 to 10 breaths, breathing out longer than breathing in. When you get up slowly, one step at a time. Sitting down, energizing asana. Balancing asanas. Chest opening poses. So if you can sit down comfortably, one of the powerful asana is your prayer pose to the back, called Paschim Namaskar. So I can show it to you, you can do with me, and you'll see the effect of it in your body and mind. You slowly take your hand and bring it close to you. You can bring it here, it's fine. Close your eyes, breathe in and out. Eventually and slowly, in time and progression with the neuroplasticity, you'll be able to put your hands together, and with your timing, 1 week, 1 month, 6 months, 6 years, sometimes in your lifetime, the hand will keep going high up. And I will stay here with my eyes closed, with my breathing, breathing out longer than breathing in. You always breathe through your nose. Do not breathe through your mouth. When you breathe through your nose, the air gets filtered, air gets warmed or cold, nose is like air conditioner. Air goes to the side of the nostril called turbinate, creates a vortex, it goes to the larynx, and if you're doing properly nasal breathing, you might develop a little cough. Cough comes from your larynx, and the air can go into the larynx, can irritate. When you do it, take a deep breath in and out effortlessly, which you don't try. It happens totally on your own. You try to slowly extend your inhalation, extend your exhalation, and that way your respiratory rate goes down. When the respiratory rate goes down and you can extend your inhalation and exhalation, the breathing gets deeper and deeper, and it gets longer and longer, both exhalation and inhalation, and you get a profound therapeutic effect from this pranayama practice along with the asanas. Breath is the connector between your body and mind. And the effortless breathing practice takes you to the state of meditation. Meditation is the medication. So I'm sitting here, now I'm talking, see my hand will go up a little bit more. If I stay here, go. I do it every single day, so I have no problem staying in this posture for hours and hours without any effort. This is my normal posture of my body. Then you incorporate this is called a rotating your neck, called your Brahma Mudra, relaxation of your neck. You can incorporate a lot of other things. You can incorporate a bumblebee breathing called Bhramri Pranayama. A Bhramri Pranayama connects between your body and mind. It quiets down because it has a profound effect, because it cancels the vibration of your brain, called a harmonic resonance. Let me show you a couple of more sitting down posture before we do laying down. Standing up, we do very simple. For kapha, we'll do a tree pose called Brikkasana. We do a Tadasana called mountain pose. You do your sun salutation, Surya Namaskar. And for Pitta, people will do a moon salutation, Chandra Namaskar, because Chandra Namaskar is cooling. The same sequence as the sun salutation or Surya Namaskar is 12 steps. We start with the breathing in and it ends with the breathing out. You can do a Vaisasana. Vaisasana is called your buffalo or cow pose, like a cow face. You put one foot on the top of the other and able to sit down, and the feet here is called the metaphorically face of a cow, Gomukhasana. If you sit down here, excuse me, sneezing, coughing, some drainage, these are all part of our daily morning yoga practice, because this is due to our jalneti or netipat, clenching your nostril. So breathe, both of our nostrils are open. If you try to check your nostril, you'll see one nostril is more open than the other. And again, balancing, doing both sides equally. Now I'm comfortable here. Now see if I can do it with my opposite side. Most important here is, I don't have any pain. Pain is a sensation called paying attention. The word pain came from paying attention. Do not let the pain go away. That means do not take a pain medication and do a yoga practice, or even an exercise, anything. Even if you have a pain, you have a knee pain. The posture which is causing the knee pain, the moment you take the pain medication, you are going not to listen to your body and it will be hurting you more. Gomukhasana has another component, putting your hands together to a balance. So let me show it to you. This will be very much your kapha balancing pose, because kapha needs your strengthening, energizing, moving. So now my right knee is in the top of my left knee. My right hand goes high up. My left hand comes. Let me put your left hand in the middle. Left hand in the middle. Right hand will come down. You touch it, hook it. Essentially, I'll be able to handshake each other and stay in this posture. What are my body signals? I have no pain. I have effortless breathing manifested by I can talk, I can even sing in this posture. I feel a wonderful sense of relaxation. My whole upper part of the body, my wrist, my hand, my elbows, my shoulder, my neck, whole part is relaxed. The lower part of the body, my ankle, my knees, my hips, my back, you name it. Now it's a balancing pose to the opposite side. Now my left knee is in the top of my right knee. Left hand goes high up, right hand comes in the middle. Let me put it in the midline. Left hand will come down, hook it, close it. I'm essentially handshaking each other. And for me, both sides are equal. If you practice yourself, you'll see your one side is easier than the other side. I have no pain, I have a little discomfort, effortless breathing. Kapha balancing asanas. Kapha balancing asanas will be your downward facing dog, Alpha Mukha Svanasana. If you can do, you see me? Yes. Then Flora, you can do a push-ups and come back higher. It will be all coming. So even these push-ups, a lot of ways you can do the push-ups, yogic push-ups, and then you can sit down in a Vajrasana. Sit on your ankle, and then a lot of people ask me, I have a hard time doing it. But able to do it, I have a lot of people who had a knee problem. In fact, knee problem is gone. They even canceled their knee replacement surgery. And I am in favor of knee replacement when you have a functional dearrangements, like when you have a deformity, valgus deformity, varus deformity, but just simply for pain. Pain comes from the tightness. Pain fibers are in the ligaments. Pain fibers are in the muscles. So just for the pain, we say, if you get operation for pain, we create more pain. So when you're able to sit down in a Vajrasana, you get more grounding. You can get into your cat pose, Marjarasana. You separate both the knees, the hand, put your both the hands in front. You drop your lumbar area, look high up slowly. Breathe out first, take a deep breath in and slowly put your chin towards your chest. In a normal Bhadrasana, you go in and out, but in yoga therapy, you stay in this posture. 5 to 10 breaths. Because of the lack of time, I'm just showing it to you how to do it. But when you practice, you will do it for a longer time. If you do a camel pose, Ustrasana, you can put your hand in the ankle, push your body in the front, and drop your head down. This is grounding for your vata, and towards your belly button is for balancing your pitta. Now, if you lay down in a Savasana, corpse pose, in a Savasana, you'll be always be doing it separate your feet to the width of your mat. Then when you get down, slowly you get down, keep your face, let me see, I can see it here. You guys, so put your up to width, put your head down, and be sure your chin is not high up. If it's high up, then put a little pillow there. Try to keep your chin down, hands on both sides, palm facing high up. And close your eyes, and most relaxation is your abdominal breathing. Abdominal breathing, relaxing and parasympathetic. You say baby, baby always do abdominal breathing. Put your one hand in the belly button, the hands will go high up and will come down. One grounding pose you can do from here is called your fit raising Paduttanasana. Not all the way 90 degree, 30 degree. From here, you can do a pitta balancing pose is your Nokasana, boat pose. If you do a boat pose, it is centered towards your belly button. And you will see that shaking slowly and slowly will come down. From here, you can do a knee chest called Pavan Muktasana. This is to balance your vata. You can do roll side to side. From here, you can do your bridge pose, Setubandh Sarvangasana. Separate your feet up to the width of your shoulder. This hand touches behind your ankle. Clasp your hand and slowly raise your body high up. Once you're properly grounded, this is to balance your pitta and to include the vata. You can raise 1 foot high up. And to balance, you can do other side. Slowly come down. You'll see when you do that, your breathing becomes very effortless. This is your modified boat pose. Put your hand and slowly get your feet down. Wonderful grounding asana. For the students, we also have a class tomorrow. We'll be doing the other asanas tomorrow also. And in the afternoon, we'll show you your pranayama and a meditation practice to balance your doshas, vata, pitta, and kapha. Many of you who have been with me for a long time, you have seen that Ayurvedic Yoga Therapy. I have your YouTube videos, and let's show you a shoulder stand with a plow for grounding, and then we'll do how to sleep. Very important. Healthy person should have strong digestion, easy elimination, and a good night's sleep. Who you learned it from? You learned it from the babies. A healthy baby eat, poop, and sleep. So from here, you can get into your shoulder stand very easily. There's a lot of other things. You can do a Gururasana. You can do your lotus pose in a shoulder stand. From a shoulder stand, these are all relaxing asanas. You can go to your plow. Remember, for you need to stay in the asana for about 5 to 10 breaths. Sleep is the most important component of our daily practice. Who is the best sleeper? Babies and yogis. And let me show it to you how the yogis sleep. First, yogis will sleep like a baby. Have you ever seen how a baby sleeps? Babies will take both the feet, touch both the feet and both the knees on the side. This is called Supta Baddha Konasana, laying down close angle pose. Take a look at the babies. Every baby sleeps like this. If you cannot support, you can put down a couple of pillows under your knees and get supported. Incorporate abdominal breathing. Breathing in, abdominal wall will go high up. Breathing out, it will go in. Then you will incorporate breath holding. Breath holding increases your carbon dioxide content in your body and is called a CO2 narcosis. It is the effect of narcotics. What generally we do, count of 4 in and hold it for count of 8, or count of 5 in, hold it to the count of 10. We'll do it about 5 to 10 times. For the time's sake, I'm going to just show it to you one time and to see how to do it. Same as abdominal breathing. I breathe out first. Breathe in with a count of 5 in. Hold for count of 10. Let go. If you're doing it a few times, maybe 5 to 10 times, simply breathe out first. Breathe in with a count of 5 in. Hold it for count of 10. Then you do the Nadi Shuddhi Pranayama. Cleansing your channel, you'll be breathing in, hold, breathe out. Ratio is 1:4:2. We'll be doing 4 seconds in, 16 seconds holding, 8 seconds out. I'm going to show you one time, but we do it multiple times. Generally, there is a lag time for sleep. You don't fall asleep right away. It takes between 10 minutes to 30 minutes to go to bed. If you sleep less than 10 minutes, you are sleep deprived. You may have a sleep apnea. If you go beyond 30 minutes, you can fall asleep, you have insomnia. Then you will know we'll sleep on the right side and the left side. All the yogis sleep on the left side. Let me show you breath holding what we do. Breathe out first. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. One is to 4 is to 2. Do it a few times. You will feel that sleep is coming to you. Initially, for yogis, sleep on the right side in a fetal position. Generally, they take both the hands and put the head on the hands. They don't need any pillow. And keep the knees bent. It is also a balancing practice. Initially, our body core temperature is high up, and laying in the right side on left nostril opens up. Left nostril is a cooling, Chandranari, parasympathetic. It balances the inner heat of the body. Slowly, when you get into the sleep, the body core temperature comes down. All the muscles get relaxed. Slowly you turn around and get into your left side of the body. You sleep on the left side of the body. You can put your head on your hand, or you can lay down on your head, put your hands on the sides. I've been sleeping it for a long, long time on the left side. The left side, right nostril opens up. Right nostril is heating, Suranari. Right nostril is sympathetic. Right nostril is male. It balances the cooling inner temperature of the body. The right side of the body, the main channel where the blood returns to your heart, is called inferior vena cava. It comes to the right side and returns to the heart, laying on the left side. It is a very low pressure system. There is no pressure, there is more return. It is called a better preload of the heart. Preload is a more return of the blood to the heart. Relaxation response relaxes the peripheral blood vessel. And for the heart, it is called an afterload. Afterload comes down. Increase in the preload, reduction in the afterload increases our cardiac performance and ejection fraction of the heart. Also, other abdominal contents on the left side, which are not there. In fact, in our prenatal yoga, when the uterus is enlarged with the baby, we always let them lie down on the left side, even if you do your yoga nidra or savasana on the left side. So you don't have a pressure on the inferior vena cava. Try practicing this. You will have a wonderful sleep, if not today, tomorrow, within a few days. And it also varies from person to person. It might take somebody in a few days, few weeks, few months, but you will have a overcome. You'll overcome your sleep apnea, overcome insomnia. You do a pranayama called Ujjayi pranayama. Ujjayi pranayama controls the sleep apnea. When you get up, straighten up your right foot, put your one hand support, and slowly get up and sit down. First, when you get up in the morning, do not try to get up because your body is already relaxed. All the inner core temperature is down. You need to have a little bit of a balancing. Balancing will take a little time. We call it 90 seconds rule. Sit down for 30 seconds. Then you stand up and wait for 30 seconds. If you suddenly get up from the bed, especially for people, little mature people like us, you develop called a postural hypotension. Blood pressure might drop down, you might get a little bit of a dizzy, you might even fall down and get hurt or injure yourself. And then our daily routine starts. We first sit down in a squatting pose called a malasana. In a squatting pose, our pelvic floors are relaxed. Your anorectal area, junction between your rectum and the anal canal, normally there is a kink which prevents our incontinence. That straightens up to get a proper bowel movement. Even if you sit down in a commode, I have it in my every commode. It's called your squatty potty. Put a squatty potty, put your feet high up. Looks like you're sitting like a squatting pose. After drinking 2 glasses of water, and the water you drink in a gulp, take a gulp, it starts the peristalsis. Then when your water goes into the stomach, it starts the phenomena called gastrocolic reflex. Stretching on the stomach causes contraction of the colon, get a proper bowel movement. Brush your teeth, scrape your tongue, do the jalneti, cleanse your nose, then go into the morning practice. 1 hour of practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. For the students, we'll do the pranayama and the meditation practice this afternoon, and the other asanas which we practice, we'll do tomorrow. One powerful yogic practice is able to get up without a support. Suppose you're sitting like that. From here, if you're able to get up, slowly you get up without a support. You also do it same thing throughout the whole day. You sit down in a squatting pose and you get up without a support. And do it a few times every single day. And that's your stretching, but able to get up from all the way to the ground. Try this. I do it all the time when I teach a class. Cross your feet, sit down in the ground. From here, see if you're able to get up without a support. It's a wonderful practice. I hope you got something out of it. And I will be here, looks like almost every Saturday. So I'll come back for Saturday morning classes. If you have any question or comments, please send it via Facebook.